Hello everyone, welcome to Generic Competencies session. This is something I think is a very important session because whenever somebody sends me its feedback form for the part 2 exam, I always find that the generic competencies is the one which is largely missing. Hope I am clearly audible and the voice is clear. Would like to hear from you all. Please chat, just write in the live chat if you can hear me clearly. It certainly would be helpful to know if I'm clearly audible so that I can continue further with the session. Please chat, just write in the live chat if you can hear me clearly. Yeah, good evening, very good evening. Thank you. Yes. Okay, great. That's very good to know. Okay, so let's start. So basically, as I was telling you, that generic competencies is one topic which I have always seen in all the feedback forms that it's largely missing. And many of the students do text me also that what is actually included in the generic competencies and how we can improve on it, right? So it is very important. Even if we do not know what exactly it is, then it becomes very difficult. And I think we all are doing this as a part of the curriculum, but we are not focusing too much into it because we believe that this is something we already know and we practice and we can make it happen. So let's dig this topic in some details, although it's a very huge topic, but yes, certainly I'll be covering few of the points and giving you a proper roadmap of how you can work on this particular topic. So mastering generic competence is the hidden key to part 2 success because it's a very important part. Don't let non-clinical questions be your reason to fail. So here we go with MRCOG courses and ensure your success in 70% their study time, as we always say. So what is actually the generic competencies is? What are generic competencies? Ethical decision making. So that's one of the very important part. Patient safety and risk management, consent capacity, confidentiality, data protection, breaking bad news, the good communication skills, the leadership skills, multidisciplinary teamwork, dealing with the complaints and the conflict, duty of candor, and the clinical governance. So, multiple things. They are basically the competency, your competency to make you a safe, efficient doctor. So, if you follow these norms, which the NHS, RCOG, GMC are looking for, then you are a safe doctor, and that's what the NHS is looking for. So to judge that whether you are on the right track of becoming a person like that, they are, of course, there are large number of questions related to these topics. Now, because what happens is we know that these questions are coming, but we think about these questions as some kind of like maybe this is a better answer. Maybe if I would be in a situation, I'll do this, that. So, like this, we try to make up the decisions. But actually, that's not how it works. There are proper rules for it. And it is very important to know the rules, the regulations, the laws behind it, and particularly the concepts behind it. For your EMQ, it's always very important to go through your concepts. So, why are these so dangerous? They look very simple, but they are the most failed category. Not covered well in most books. We don't have any green top guideline for that. We don't have any nice guideline for that. Many of the books even do not have the questions about it. So we do not get lot many questions. We really rely on whatever recalls are available. Need the UK NHS mindset, not just medical knowledge. Sometimes you may find that when you are answering the question, you are medically right, right? But that's not what NHS is looking for. So I already told you it's more about looking at you as the effective and the safe doctor. So let's dig further details into it. Where actually the students go wrong. Skipping the non-clinical topic, assuming that they are not important. Oh my God, this I'll do. I absolutely know when to take the consent, what can be done with the consent, without the consent, and how to deal with the situations of sexual offenses. We have been doing this in day and day out, but so think that not it's not important to know in details about it, but choosing what feels morally right instead of what is NHS compliant. This is the biggest mistake, because what we think morally right and what is actually morally right may not be what the ethics is followed in the NHS compliant. Because it is not about just being a morally right, it is about legally right as well. So you have to look into that also. Guessing in ethics questions without clear strategy. Another big mistake, and the very common mistake, particularly, I would say. So ethics questions are there, and you just think about it like from your knowledge, whatever basic you have, and you go and take the answer. But a clear flow chart or the strategy is not there. In today's session, we will be talking about the unexpected things which come up during the surgeries, and a flow chart and the algorithm about dealing with these situations. We are also going to talk about the questions, but I'll definitely give you algorithm as well, which you can follow to answer such questions whenever they appear in exams. Non-practicing these scenarios under timed SBA conditions, and then confusion in best and the correct answers. What you think best may not be the correct in view of NHS. So we need to understand what is best and what is correct. So let's go ahead with this. Here we start with the questions. So as you can see, I'm putting up a theme for the question, right? Because as I have already listed, there are so many themes. We are going to take at least 4, 5 themes for today, and we will talk about the questions related to that. So the first question comes from the communication skills. Now, you don't have a green top guideline or the nice guideline for that. So where does this topic come from? There is a very good lesson in the RCOG e-learning, and this is something comes from there. We need to know the concepts of good communication skill, because this is one of the non-technical skills which is very important while you are practicing. So here we go with our first question. And I'll be waiting for your answers in the chat box before opening up the correct answer. So be ready. Be ready to write the answer. 24-year-old woman with a history of chronic pelvic pain has recently had an ultrasound of her pelvis, which has been reported as normal. You are meeting her in the outpatient clinic today for the first time. She is very upset and has told the nurse that she feels like no one is taking her concern seriously. The woman reports that the ultrasonographer made a comment about her ovaries during the ultrasound, and she is worried there is something seriously wrong. So very common scenario in our OPDs. A woman, she has been suffering from the chronic pelvic pain, and when she underwent the ultrasound, she was told that nothing is there. So she's largely disappointed because she feels that nobody is taking care properly, and that's why they are missing up the diagnosis. But she is also concerned that the ultrasonographer actually mentioned something, that the ovary has something wrong. So, what is the most appropriate approach during your consultation? Let's see who is the first person to answer this question correctly. So, what are your options? Assess the woman's ultrasound result on the computer while you listen to her. You can check exactly what she is saying is correct or not. Ask questions to check your understanding of the woman's concern. You need to further interrogate the patient. immediately make a phone call to find out who carried out the ultrasound, or you would like to contact the sonographer, why it is not mentioned in the report, and what was actually what he saw. Remain silent while the woman is talking. You are just listening to the woman, what she is taking, and giving her time. Take extensive notes while she is talking, or you want to make the extensive notes while she is talking. So, which will be the correct answer? Yes, I'm looking at few answers, waiting for more. Please, everybody try to answer. It will be a helpful thing if you answer, you will be remembering in the exam also. So, very, very important that you start answering. Yes, good. Good. So everybody here is the right. So basically, and Dr. Srinivasan Geeta, that's thumbs up for you. You have won. And you answered the first question. You were the first to answer the question absolutely correct. So ask the questions to check your understanding of the woman's concern. See, D option also seems to be okay. D option is remain silent while the woman is talking. You may think about, like, you may sit and listen to the woman carefully is a good communication skill, but it's that you need to check her understanding. You need to actually find out where the things are not aligning. So, asking the questions to clarify is a better communication skill rather than just simply sitting silently and waiting for the woman to talk. So, B is the correct answer. The correct answer is ask questions to check your understanding of the woman's concerns. Asking the patient questions to check that you have understood is a good way to demonstrate that you are listening and that you think that what they are saying is important. Try to avoid the distractions. That is absolutely wrong that you are making some notes, you are taking the phone calls, looking at the notes or the computer, as this can give the impression that the woman is not the focus of your attention. However, active listening is not the same as remaining totally silent. Active listening means you are echoing, you are telling something, right? So you are engaged with the patient. So even a simple phrases like yes, go on, or like something or demonstrate, you are engaged. So that's a good communication skill. So very good attempted. So here is another question for the communication skills. 35-year-old pregnant woman attends the antenatal clinic at 34 weeks of gestation to discuss VBAC. Her 10-year-old son accompanies her. You notice that she has failed to attend two previous appointments. It quickly becomes apparent that the woman speaks very little English. However, her son is a fluent English speaker. Her mother in law is in the waiting room and speaks good English too. What's the most appropriate way to continue this consultation? Very important point, because in the recent memories, when they were looking at the causes of the mortalities, so one of the important factor which came into account was that there was a problem with the language. Language barrier has been a very important topic. And you can expect actually one question on the language barrier in your upcoming exam. There was a question in the last two exams also. So same you can expect right away also. So what are the options here? I would expect somebody else to answer the question first, and so that we can have another winner today for this question. Looking forward for who is going to answer this first. So here are your options. Ask the woman's mother-in-law to interpret. Obtain a professional interpreter for this consultation, telephone advice. Reschedule the appointment and book a professional interpreter. Use the woman's son to interpret and use very simple words so that woman understands. Yes, I could see two options here, B and A, in the chat box. So, yes, the correct answer is B, and the winner for this question is Dr. Yashasvi Pandey. Very good. Well done. And the B is the correct answer. So here we obtain a professional interpreter for this consultation. We can never take relative as the person to interpret this, right? So always we need a professional interpreter. So confusion can occur between B and C, whether to just do a telephonic service and talk with the interpreter, or you can reschedule the appointment because this is a patient, elective patient, right? There's no emergency here. She's at 34 weeks to discuss her birth plan. So she could have waited for another. But they have given you an additional information here. So what is the additional information which is given here and which makes the answer B and not C? Which is you notice that she has failed to attend the two previous appointments, right? So this is one word which has changed the answer from C to B because she has already paid for the previous appointment, so she may not come back and attend the appointment this time too. So therefore, we cannot wait. So if we don't want to wait, we can immediately have the interpreter telephonic service. So your A is not correct because we are not looking for the relative to go ahead. Yes, this is a good option. B is a good option. C is also a good option, but the problem is patient may miss the appointment. So for now, we are not going to pick up this. Sun is not the good way and simple words is not a good way. So B is the correct answer here. And remember, this same thing holds true for emergencies as well. Even if in emergency, we will still try to arrange the interpreter for the patient rather than relying on any other source. So, because when you look at the emergency, they give you like the patient is in for the cesarean section, you have to do it urgently and can you take the help of the husband or some relative or the hospital staff? So no. Ideally, it should always be the professional interpreter. So professional interpretation services should be provided to all pregnant women who do not speak English. This is a dictum, and this stands true for the emergencies as well. This is very important thing because you may become confused when the situation is there for the emergencies. So using the mother-in-law is does not make sense because she may not understand or she would be not the right person to talk about that. And of course, the son is also not a good option. Rebooking the appointment is not the best option as there is a history of missed appointments. So therefore, professional interpretation services should be provided to all pregnant women. Okay, great. So thank you for a very good participation. That really makes the session interesting and interactive. Thank you for joining. So here is the third question. This is also about the communication skills. 35-year-old nulliparous woman attends. This is slightly tricky, so pay attention to it. 35-year-old nulliparous woman attends the antenatal clinic for the scan review at 36 weeks of pregnancy. You are about to transfer her back to midwifery led care when you note that she has a birth plan which states very clearly she is not willing to have an instrumental delivery under any circumstance. You explore this with her, but she remains adamant she will not consent to the instrumental delivery. What is the most appropriate next step to ensure this potential problem does not become a source of conflict? So basically, the patient, she is here for the review, but she does not want to go for the instrumental delivery. You have tried to console her, you explored why she does not want, but she is still adamant. She is not ready to consent for the instrumental delivery as of now. So, what is the most appropriate next step to ensure this potential problem does not become a source of conflict? Because later on, if anything goes wrong, there can be a conflict which can come up here. So, what is the correct answer? Alert the supervisor of the midwives, ask the consultant to see the woman, ask the woman to rediscuss her birth plan with the community midwife, and document the discussion and her wishes clearly in the hospital records. Refer her to see the psychologist. So these are the various options. What could be the correct one? See, I told you this is a tricky question. So I'm again giving you a clue that you have to think what you can do to actually ensure that the problem does not become the source of conflict. So, most of the answers which I can see in the chat box are D, right? I'm still waiting for the winner of this question. Yes, yes, yes. Anybody else would try to go ahead with that? We try to answer it. Okay, okay. I think I have a winner, but that's showing by the name of user. So I don't know. It's the A is the correct answer. There is the name of by the user and Dr. Hadia. Dr. Hadia is also written as A. So there are two winners because I don't know who user is. So we are taking up two winners here. So that's so basically A is the correct answer here. um, D is a good option, right? We do that. Whenever the patient is not willing for something, we definitely do that. We try to discuss, document the complete discussion and her wishes clearly in the hospital records. That's absolutely fine. But the problem is what? Is this going to do settle out your responsibility? Or if any conflict arises, that this will be the one point. So we need to be prepared. Of course, we need to document the discussion and this all in the hospital records. That's a must thing to do. But simultaneously, we have to make the preparations that we are ready to handle this situation. So A option gives you that flexibility. It alerts the supervisor of the midwives because that way you will be prepared. So the answer is alert the supervisor of midwives. The consultation in the antenatal clinic gives us the opportunity to highlight and discuss the potential problems that could be encountered when a woman presents to a delivery suite in labor. This can also be a valuable time to discuss these potential problems with other members of the staff, including nurses, midwives, juniors, doctors, and other colleagues who may be on call when these women present. If a woman has a birth plan that you are concerned may put her on her or her baby significantly at the risk. So first thing is to alert the colleagues and the supervisor of the midwives who may be called upon when she is in labor. This may help to reduce the potential conflict. So that's why what I said in the very beginning, which in general may sound to be a best answer, may not be a correct answer. So this is a clear-cut example of that question. The D option seems to be very good because you are putting up that discussion in the hospital records, but yet that's not the best thing to do for this patient, particularly if you look at this particular sentence, the potential problem does not become a source of conflict. So basically, you are trying to get over the problem. So that can be by alerting the supervisor of the midwives or alerting the staff and making them prepared to handle this situation effectively, right? So therefore, A is the best answer. Does it make sense? And yes, I've already announced the winners, user and the Dr. Hadia. Those who have joined right now and they are attempted for the January 2026. For them, let me tell you, we have a full course also going to start from the July, and it includes, if you join now, it includes the crash course and the EMQ workshop also as the bonus. So that can be there. And of course, with all of my candidates around, they can just give me a shout out that what how they are feeling for this. You can write in the live chat how do you feel about the course. Many of my students are here today in this. So we include everything, all guidelines, summaries in a very small video format. We discuss complete RCOG learning strategy questions in the live sessions. Our live sessions are totally interactive sessions. Then there are mock tests. Then we have discussions going on without actually holding you long with us. We believe that you can study at your own pace, and we believe to decrease your study time by 70% so that it becomes easy for all busy professionals. And no course offers access till pass. So unlimited access is our unique feature. This is the QR code which you can scan for your this particular course enrollment. What makes our course unique? 70% less study time, structured path, and recall based learning. Study only what comes in exam. Read only what is required to pass. Live recall sessions, nobody is conducting. Yes, we do all the recalls live. Exam based filtering of the content is there. And ultimately, the unlimited access till you pass, no need to pay again and again. If you are still not sure or you want to have my guidance for your exam preparations, then this is a free strategy call which you can book with me by scanning here. Okay, there is another question I can see here. Abundance is sometime answer to these scenarios when malignancy is suspected. So what lines change the answer here? What lines change the answer here is that the patient was waiting for a long time and finally after 7 months she could get the operation theater. That is the main line which changed the answer here. Okay, so here are the three options for you all: attempting for July 25, going for 26. And if you are not clear, this is the call here. And thank you so much, Dr. Geeta. Yes, you are my student. I do recognize that. So here we finish our session today. And thank you so much for being such an amazing audience.